Hey guys, welcome to Everything and Anything with Mac, Ma Ellen. Before I introduce my guests, I just want to go over some sponsorship. Rock Kingdom Financial. If you need any guidance in retirement or life insurance or debt settlement, please text wealth to 310-251-6217. All right. So today, since today is the month of October, which is uh, breast cancer awareness, I wanted to just kind of reach out to a couple of women, and I got to spend some special time with this individual, and I'm so excited for her to share her story about just what she went through with breast cancer. Please welcome my good friend Fran.
Hi.
How are you, love?
I'm good.
I know Brandon's kind of like she's on the upskirts right now because she didn't realize it was going to be an actual video. She thought it was just going to be a voiceover. Fran, thank you for your time, though, sis. I know we shared a lot just here and there with Texas. I was actually listening to a lot of things that you spoke about at our retreat just recently, well, tell me, love, how did it all start? Like when you first diagnosed with breast cancer?
Well, actually prior to being diagnosed, I actually had symptoms. And I want to say it goes back to prior to even September of 2018.
Mm.
So I was diagnosed in January of 2019, but again, prior to that I had been feeling pain. And it was so bizarre because it wasn't pain necessarily on my breast, but pain like underneath my arm, like my left armpit. And it was just uncomfortable pain. Like it was bothersome in the beginning. And I said,
Yeah.
no, maybe it's just whatever. It's nothing. And, I just kept ignoring it. And the pain just got worse and worse. And it was weird because I had made an appointment with the doctor at Kaiser. And my doctor, examined me. He's like, oh, I don't feel any lumps in your breast or any lumps where you're complaining
Yeah.
about. So probably it's just muscle spasm. I said, okay, muscle spasm, we'll go with that. And then weeks later, the pain gets worse. I'm now taking ibuprofen for it. And then I make an appointment. Oh, I go to ER
Mm.
because on top of that, I'm also having other issues. So I'm like, okay, great. Let me just go to ER, complain about my issues, and find out what's going on. Well, the ER doctor, same thing, examines my breast, examines my arm. Well, I don't feel any lumps. I don't feel anything that's,
Yeah.
indicating it could be any kind of breast cancer. And the fact that they kept indicating that the fact that it was more painful when people would touch it, like put pressure
Mhm.
on it, that's not cancer. Like, so he too said, I'm going to give you some muscle relaxants, blah, blah, blah.
Yeah.
Same thing. Weeks later, again, almost a month. Now we're like in November. I call my doctor and I said, you know what? Something's wrong. Like
Yeah.
at this point, I'm really worried. And he's like, okay, well, you're about to have your yearly mammogram, your yearly pap smear, yearly physical, everything. Why don't we wait? You're going to have a mammogram done. Okay, that makes sense, right? So at that point, I'm waiting. Now I have an appointment early December. Okay, I go get my mammogram, all my tests. Voila, I get a letter in the mail from Kaiser. Congratulations. Your mammogram results are okay. We show no sign of breast cancer. However, you do have dense breast tissue, which sometimes can allow the mammogram to not detect breast cancer. So,
Wow.
being a patient, I don't know what dense breast tissue
Yeah.
is. I don't know anything about that stuff. As long as I see congratulations, I'm
Yeah.
good. Okay, Fran, stop freaking out. You got your mammogram results.
Right.
It's muscle pain. It's just something. Forget it. So by, I want to say maybe mid December or close to the end of December,
Yeah.
now I'm calling my doctor again. I'm like, dude, I don't know what's going on, but this pain is
Yeah.
really excruciating. It's to a point where I can't even leave my arm down. Like literally I have to be like, like leaving my arm
Oh.
away from my body because just
Yeah.
putting the pressure on it, it was really painful. So he's like, okay, well, all I could do is schedule you with an appointment with a surgeon. Believe it or not, by the time I go see the surgeon, just from so much massaging of that arm underneath it, like, literally, I even would tell my husband, "Can you just, like, massage my arm?" Like,
Yeah.
who does that, right? Massage under your arm. Like, usually you massage your muscles over your body, whatever.
Well,
At
I
that
do.
at that point, I I do feel some kind of tiny, like, bump or something, just from constantly massaging it, and
Where
I
in your arm or
under
your
my armpit.
Oh,
Yes.
wow.
So I'm like, "Oh my god." So I tell my husband, "Look, feel this. Do you feel that?" And he's like, "No." He couldn't feel it because it comes and goes.
Yeah.
So I go see the surgeon, and the surgeon tried to dismiss it as well. He does his normal exam, checks my breast, checks under my arm. He's like, "I don't feel anything." And I'm like, "Doctor, with all due respect," I said, "let me have your hand and I'm going to show you and I'm going to guide you to what I'm starting to feel now." He's like,
Right.
"No, no, of course." He then feels around under my arm and he's like, "Okay, I kind of feel a little bit, but I guarantee you it's probably not even anything." So he finally refers me to have an ultrasound. After months and
Oh
months and
my
months later,
goodness.
he refers me to have an ultrasound and I go see the radiologist.
Yeah.
He too is surprised that even just to do the ultrasound under my arm, I'm kind of like hesitating because it's so painful. And
Mm.
at that point, he's like, "Okay, well, I really don't think this is going to be cancerous. It's probably just like a cyst or something." And again, the fact that upon touch, it's painful for you,
Yeah.
that's not cancer. I said, "Okay, whatever." He's like, "But I'm going to go ahead and biopsy it regardless." So
Good.
he does. And lo and behold, when I get my results, he says it's cancer.
Wow.
And I was so, so upset. Like, are you kidding me? I'm sorry, I forgot to mention when I had my pap smear and stuff, even telling the gynecologist about it. And she does her thorough exam, nothing.
Wow.
So after seeing, I don't know what, 4 doctors and finally being referred to an ultrasound
Outrageous.
appointment, I'm just like, that's it. I told my husband, "You are going to work tomorrow. You are going to
Yeah.
go to your HR and you are going to take us out of Kaiser and
Yeah.
switch us to to a PPO plan." At that point, he did. So thankfully, we were able to switch to a PPO plan the following month. But I didn't want to treat with Kaiser anymore. I thought, you know what? They
Yeah.
misdiagnosed me.
Yeah.
Thank God that I listened to my body and
Yes.
something kept telling me, like, go back. Don't just think it's nothing. Just keep going back and keep going back, which I did.
Yeah.
And
For how long going back and forth with these doctors did it take you to actually get results? The results that, that was going to help you for your healing process.
I want to say probably from September to January.
So almost a
September, October,
year.
November, December. Well, I had complained about it even before September, like I said.
Oh,
I
so
can't
like,
recall when I initially made a doctor's appointment.
yeah.
Probably, yeah, like a year before that,
Oh
like early
gosh.
in 2018. But,
Were you
you just assume, okay, it's nothing really under your arm, really. Like, what,
Yeah. When they did diagnose you with cancer, was it in the breast or was it in the arm?
So initially, he only felt the lump in my arm.
Right.
But by the time I went to the radiologist, he noticed there was both one in my arm and a little tiny one on my left side of my breast. Just because even though I
Yeah.
wasn't complaining about my breast, I was only complaining about my arm.
Right.
He decided just to go ahead and ultrasound that whole side,
Right.
including the breast. And that's where he
You
actually
saw it.
saw another nodule. Yeah.
Oh wow.
Hmm.
Was there any way? Okay, so state that, sis. Now, you had to remove it. Did they say you had to remove it, or
Oh, yeah.
did they say why? Even though it was so small, there wasn't anything they can do to just kind of.
I asked the radiologist that. I said, if I would have came and did the ultrasound at the time that I initially was complaining about it, he said he didn't think it would even show up in the ultrasound as small as it was because it was probably about zero. I think he said it measured at 0.7 centimeters. So he said, I can't honestly answer that. He said, I don't
Hmm.
know what it would have looked like back then. To him, probably it would have been something that they would have said, oh, let's just repeat this in about 6 months. Let's revisit, the
Yeah.
ultrasound and keep an eye on it. But as little as it was, he literally said, I guarantee you I'm 98% this is going to be benign. The fact that it hurts upon touch, as
Yeah.
painful as it is, and the fact that it's under your arm too, he's like, but that's because it had already metastasized to one of my lymph nodes. So it was my
Oh,
lymph node under my arm, the cancer
yeah.
in the lymph node that was bothering me,
Wow.
not at all the one on my left breast.
Yeah.
Hmm.
But because it kind of migrated, is that what it happened?
Yeah,
Did they say, oh, that's because of now, did they say how big it was in your
they were
arm?
both under 1 centimeter.
Oh, both of them.
Mm-hmm.
But that one was more painful?
Mm-hmm.
Wow.
Crazy,
Is it
right?
maybe because are you left-handed?
I'm right-handed.
Oh, okay. Huh. Were you working out during that time?
Well, that's what they were saying. Like, are you lifting heavy things?
Yeah.
It was every time I went and saw a doctor, that was the main question. Are you lifting heavy things?
Yeah.
Okay, yeah, I had grandkids at the time. Like, they were little. So, you tend
Yeah.
to hold them more, me on the left side. So I thought, okay, maybe that's just what it was. I said, no, I'm a paralegal. I don't lift things for
Yeah.
a living. I don't, no.
Yeah.
And it
No.
was it was before I even joined the Fit Sistership.
Oh, it was
It was
before.
before.
Oh, so you actually had it removed before you started
Before,
working out.
yes, yes.
Wow.
Mhm.
So you going through this whole ordeal with the doctors, the medical field, and then having to remove it, has it changed you as a woman? Do you feel like it?
Um, you know what? A lot of people ask me that, and I I tell them the same story.
I was like, not like boobs is everything, but I mean like
To me, I mean, I can jokingly say, like, when you're an A cup, that don't matter. Like, what are you losing? If you don't have nothing to begin with,
I
like,
know.
it's okay. Just,
You just kind of like, okay, it was there, now it's gone.
now it's gone. And what the funny thing is, the surgeon only wanted to take that one off, and I'm like, what? You're not leaving me with one nut and no nut on the other side. I said no, especially because I was
Oh
diagnosed
my
anyway
gosh.
with triple negative breast cancer, and that's the
Wow.
worst kind to have.
Is it?
So majority of the breast cancers, from what I understand, you always want to be hormonal positive. But when you're triple
Mm.
negative, that means you are hormonal negative on all ends.
What does
I
that
can't
mean?
remember, but it's you're estrogen negative. The three hormones of our system or our breast. I'm not sure. I should have.
It's like negative to the 10
It's
power.
negative. Yes, yes. Sometimes
Okay.
you're positive in two of them and negative in one, but when you're strictly negative in all three, that's not good because there's no treatment for us.
Oh,
So the
wow.
only thing left for us is chemo, surgery, radiation, and you hope and pray to God that it's going to be gone for a long
Yeah.
time.
So that's why you just suggested to just take them all out, right?
Yes, I told the surgeon, "Oh no, if there's a a chance that it can
Come back
come back or even come out on the right
on the
breast,"
right one.
I said,
Yeah.
"No, no, no. I want you to remove both." And she's like, "Okay. I mean, you're the patient. You have the
Oh,
final say." So,
how was your recovery, sis?
you know what? It was good. It was really
Oh,
good. I didn't have any problems. I Nothing got infected. I had
nice.
two drainages on each side. And that was the fear of the surgeon. Like, why mess with something that's not, affected?
Yeah.
You run the risk of during surgery or after it being affected, infected and having to go through so much again. And I said, I'm sorry, but I'd rather much go through an infection than to know
Yeah.
years down the line that breast cancer is back on the right side. I
Yeah.
said, so yeah, no.
That's a big deal. I
Yeah.
I just love your you trusting your body
Hmm.
to know better if something doesn't feel right. I think a
Right.
lot of times we kind of put things under the rug because we think these professions or these professionals or our doctors mistakenly are not reading certain things. But
Hmm.
knowing your body as a woman, like I think that's pretty cool that you didn't take it. You just went and got another person to be able to like or know what's going on.
Hmm.
I'm not feeling well and you need to help me
Right.
out.
Right.
I think the boldness that you did there, especially for your life, because I'm pretty sure that it could have expanded more or grew bigger
Hmm.
and then took you out completely.
Right.
And that would have been terrible because I know you have grandbabies and you have a whole family
Mhm.
that you love dearly. What would you say for those who are, going through things right now? Especially like, well, I should say losing your breast. Like, I know I just recently told you about a cousin. What would you say for the other woman who has to lose their breast, but they don't want to lose their
Well,
breast?
I know,
Yeah.
I have a coworker, and it's so ironic that my coworker,
Mm,
who sits literally in the cubicle next to me,
wow.
we were diagnosed with the same breast cancer like 7 months apart.
Wow.
We often wonder, is there something in this old building that,
Man.
how ironic, right? For a coworker
Yeah.
to be diagnosed with it first. And we're all over here Googling what's triple negative. So thankfully, I kind of knew what it was already based on her diagnosis. 7 months later, I get diagnosed with the exact same thing. But going back to your question,
That's,
she was the type of person that really, adored her breasts.
yeah.
She had breast implants before, and
Mm-hmm.
so losing it for her was a big deal. She actually didn't even want to remove the whole breast, and she didn't. She had a lumpectomy. She chose the lumpectomy where they just removed the portion where the cancer was.
Was that an option for you?
No, the option for me was to just remove the left side, the whole breast.
Oh, they didn't have that
Again,
option.
but see, I went to City of Hope. Once my husband transferred,
Oh, got it.
switched insurance, I left Kaiser. So who's to say? Kaiser probably would have offered that same,
Yeah.
just do a lumpectomy and remove just the cancer part, right?
Yeah.
But I went to City of Hope. I transferred out of Kaiser, got the PPO insurance, went to City of Hope, which is a cancer institute, and that's all they do is treat cancer patients. No other
Mm.
patients but cancer patients. And they're constantly doing researches and trying to find ways, of
Yeah.
better medication, better with technology now, they're just it's a research center.
Yeah.
So I'm not sure if that would have happened to me had I stayed at Kaiser.
Yeah.
Unfortunately for her, her cancer came back.
No.
Now she's going through chemo again. And again, it's like, I thank God didn't stay with Kaiser, because would I have been in that same situation? First, Kaiser already misdiagnosed me almost a whole year later. And then the treatment that they wanted to do, I told the doctor at City of Hope what they were planning to do with me had I stayed with Kaiser. And she said, absolutely not. She said, you're young, you have no underlying conditions. We're going to treat this aggressively. I'm going to
Wow.
give you chemo every 2 weeks, which is more aggressive, versus a lighter dosage every week, which is what Kaiser wanted to do.
Mm.
So, you know, I mean, like I said, I had no problem.
Yeah.
Immediately, I said, take them, take them. If this is
Yeah.
what was going to kill me, I don't want them. Versus maybe, another woman would have said, oh my God, you're taking my my
Womanhood.
womanhood away.
Yeah.
I never felt that at all.
Wow.
Yeah,
Well,
it
of
was.
course not.
No, I mean, come on, no. If it was like I said,
Yeah.
something that's going to kill you, you rather
Yeah.
remove it, knowing that in the future, years down the line, you can replace them. Like,
Yeah.
it's you're automatically approved for any kind of reconstruction, be it implants or
Yeah.
the graft type of surgery.
Mm.
Which is what I can have if I choose to.
Yeah.
Um, but no, it didn't bother me. I mean, honestly, what bothers me is when I go and I try out blouses or bathing suits or bikinis. At that point, I'm like, damn, man, what,
Just stuff it. Just
Yeah.
stuff it. Just stuffing it in, huh?
Yeah. But
No, I mean like,
yeah, no, that really didn't put me in any kind of depression, because I was losing, my womanhood. I
yeah.
looked at it as it had to be taken. I had to get rid of it.
Yeah.
And that's all that mattered.
It was a matter of life for, the boob, right? I
Right.
know what you're
Like,
saying. It's like, really? Like, is it about the look or is it about health or is it about life?
right.
And I love that. I think your story is very powerful. I know the different stages that you went through. Now,
Mhm.
do you plan on doing reconstruction or you're just like, I'm cool. I don't want to.
No, I kind of told myself, if I'm, cancer free beyond 3 years,
Oh,
or
okay.
later,
Yeah.
I
You're open
may.
to it.
Yeah, I'm open
Yeah.
to it.
Did it change you and your hubby? Do you mind me asking? Did it change you and hubby?
No,
He was just like,
He was just like, I'm going to love you the way you are, regardless. I mean, uh, you're
oh,
losing that, but I'd rather not, I'd rather you lose that than to lose you in general.
yeah.
Let's just go
Yeah.
with it. And
I know it sounds like a superficial question. I'm just asking because I know um, people really go through that.
yeah.
When times are tough, there are spouses. I shouldn't even just say for either or, but when they do, when they literally say sickness and but for better or for worse or through
Sickness
sickness
and
and
in health.
health,
Yeah.
I really take those vows very seriously. So for you to say that, I mean, for hubby, I just want to give a high five shout out to hubby. What is hubby's name anyways?
Bob.
Bob. Bob, you are such a beast. You're a winner. You're a winner. So I just wanted to say that. But how are your kids? Like, do you see, is cancer running your family?
You know what it does? Not breast
Oh,
cancer, but on my
okay.
mom's side of the family, cancer runs heavy. I
Mm,
mean, I've lost my grandmother to lung cancer, an uncle to throat cancer, an aunt to ovarian cancer, but none of them with breast.
yeah.
So, because I have daughters and I have sisters,
Yes.
I opted to have the genetic testing just to see by chance. And thank God, it was negative.
Oh, awesome.
Yeah,
Praise God.
I
But
know.
I'm pretty sure since this has happened, you're constantly
Oh, I'm constantly telling my daughters, when you're of
right.
age, you know, to have the mammograms and stuff, I need you to do it
Yeah.
every year, and
Yeah.
don't dismiss anything.
Right. I'm pretty sure you guys live a lot differently than how it
Mhm.
was before, like just kind of taking it lightly because I'm pretty sure that what went, past your mind of like if we would have detected it when you first initiated,
Mhm.
they could have just kind of zapped it out versus doing all these other different steps of
Right.
like removing the whole entire thing, right?
Mhm.
Well, thank you, sis. Is there anything else that you
Yeah.
want to share? I just wanted to just kind of give tribute to just for this month on it. I mean, I know it's a daily battle for you and the family. It's something that you've overcome and survived. It's such a blessing that you are still here to
Mhm.
be able to shed light and share your story because like I said, I just recently have a cousin who's going through it right now. I cannot wait for you guys to connect, though, real talk, Fran, just because I know for sure it's different when you actually go through it, right?
Right.
Versus just the outside looking in. I'm pretty sure there's so much that you guys can relate to, like, yeah, this medication made me feel this
Right.
way, or,
Right.
I remember this time when I threw up, or I don't know. Did you have to go through those stages, Fran?
You know what? Honestly, I didn't. When
Oh,
you hear about cancer patients, I think the only way people would have known I was going through cancer is because I lost all my hair. But actually, I have a friend. When I was first diagnosed, she was into the whole CBD oil stuff.
mm,
And she specifically like told me, Fran, here, I need you to take the CBD oil. It didn't have THC or anything. It was just strictly the CBD oil. And I've never heard of it. I've never taken it or anything. I'm like, okay, girl, I mean, I don't know if I should be taking this or what, but
take it.
so she's like, this is gonna help you. I had an aunt and family members that had cancer, and it helped them with their nauseousness and whatever you may experience. So I asked my doctor, hey, am I okay to take this like during chemo or whatever? And she kind of looked at me and she didn't say, as a physician, I'm not supposed to say, but I'm not going to say no and I can't say yes. And she kind of gave me that look like, go
Take it.
ahead.
Like,
Like,
take it,
it's
girl.
not going to hurt you, but it
Yeah.
can only help you.
Yeah.
And I honestly, of course, with the faith of God,
Mm,
of praying and asking
yeah.
him to please, that was my worry. My
Yeah.
worry was to have my kids
Yeah.
see me sick.
Mm,
As it is, they're seeing me bald. Like,
yeah.
it's very hurtful when you see your kids suffering.
Yeah.
But let me tell you what that CBD oil really did for me. I think it worked because I
Yeah.
took it every day
Mm.
faithfully, like every day. I didn't miss a day. And believe it or not, as I was going through chemo, never once did I throw up. Never once did I get sick.
Wow.
I got a little bit tired, which is to be expected. They do
Yeah.
say chemo, tires you out. And that's the only thing I felt. I'm not going to lie.
Wow.
Like, sickness, I can't relate because it never knocked me out. I never was in bed just laying there, weak.
Yeah.
Um, I never threw up.
Mm.
None of that. And like I said, with prayer and CBD oil,
Yeah.
I truly believe that it helped.
I love that.
And I, any other person that's going through cancer now, I'm constantly recommending it. Like, it's going to help you.
CBD oils.
It was a CBD oil that I took from the beginning.
So, did your hair grow back right away or?
It took maybe about a month
Yeah,
to
a
start
month to
growing,
start
little
growing.
by little.
How did you go through that when you lost your hair? Was that the hardest
That was
thing?
the hardest.
Yeah.
That was the hardest.
Did you wear wigs or anything or
I
no?
had to.
Yeah, yeah. She's like, I had
I
to. I
had to,
hated it.
I hated it. For the most part, I just wore like wraps,
Oh, okay. Yeah, yeah.
When I had to go out to a
Yeah.
party or whatever, of
Hmm.
course, I put the wigs on,
Okay.
went wig shopping. And
Nice.
so, but
Were you like
yeah,
red one
I want to say
day?
that probably was tougher than losing the boobs. Like losing the
Yeah.
hair was like,
Isn't that
what?
bizarre?
What?
Because they actually have to see it.
Oh my
That's
God,
why,
yeah.
huh?
So
Because they
I,
have
I
to see
kind of I
that
didn't
part.
want to just go from long hair, blonde highlights to just bam, nothing. So I kind of
Yeah.
like, chopped it up. I cut
Oh,
it
okay,
short.
good.
Then maybe 2 weeks later, cut it even shorter, got to
Oh,
a bop.
wow.
I said, no, let me lose this thing little
Yeah.
by little.
Oh,
Yeah. But
good.
it was so painful to just watch
Your
my
family.
daughters, watch them, when they broke
Yeah.
down, I was like, it was painful. But
Wow.
yeah, it's I don't know, it's just something I don't ever wish upon anybody,
Yeah.
and I really just want to reach out and tell, all the women out there, pay attention to your body like they say, pay attention to your body.
Yeah.
Us Polynesian women, we tend to feel like we're the backbone of the family
Yeah.
and nothing, can't bring us down, but in order to be strong for our families, we're wives, we're mothers,
Yeah.
we're sisters, aunties, grandmas.
Yeah.
How are we going to help them if we're not helping ourselves?
Amen.
So yeah, just be mindful of what's happening, with your body, and if it's consistent and and it constantly comes back, like don't dismiss it, don't ignore it, like get it checked no matter what, because preventing it from getting worse is the best.
Yeah.
You don't ever want to wait until it's just to a point where it's not curable, or your disease is just so bad.
To take over your body.
Right.
I believe in health is wealth. And two, especially as mommies, as wives, we want to
Mhm.
be around for our little ones, especially as grandmas. It's a whole nother
It's
vibe
a
of love.
whole nother vibe.
It's
Like
something
my
else,
kids are
huh?
adults now.
Yeah,
My
it's like,
son, my oldest son's 35. My youngest just turned 25.
wow.
So all I pray for now is just to watch,
Yeah.
just be able to watch my grandkids get older, get married.
Yeah.
It's a bonus. I always say it's a bonus when you see great grandkids. But,
Yes.
grandkids, you want to watch them,
Yeah.
grow up and be there as a grandma for them, right?
How many grandkids do you have
I
now,
have
friend?
3,
How old are they?
5, soon to be 4, and almost 2
Babies.
babies.
I know. That
Yeah.
age is like, whoo,
And
my,
I never understood when they say, "Oh my God, when you become a grandma,
oh,
it's a whole different vibe."
it
I'm
really
like,
is.
"Okay, why?" But now that I'm a grandma, it's like they're your joy. Like you just want to love them and
Yes.
spoil them and then give them back.
Uh-huh. Go home.
Go home.
I
Come back
love you.
again tomorrow.
Grandma loves you.
Yeah, grandma
I know
loves
that
you.
vibe.
Yeah.
Well, thank you, sis, for coming on today and just blessing the show with your story.
Mhm.
I pray that God continues to add so much life and health for you, just to see those babies, right? You raise them up. I'm pretty sure you're like constantly spoiling like I am.
Oh
So,
my God, constantly.
and just also you working out and doing your thing and being at this time in your life, I'm pretty sure you move a lot differently because of what you've been through and what you experienced. And I'm truly, truly excited to see what God's going to do in your next chapters. I see a lot of different things happening just because of you sharing your story.
Mhm.
Everywhere you go, it's going to be pretty awesome. So thank you, sis.
Thank you for having me.
And there you have it, guys. Mac